Cataracts are one of the most common eye conditions affecting people around the world, especially as they grow older, and they develop slowly, often without immediate notice. To understand cataracts, it helps to first understand how the eye works. Inside the human eye is a clear, flexible structure called the lens. This lens sits behind the colored part of the eye, known as the iris, and its main job is to focus light onto the retina at the back of the eye so that images appear clear and sharp. In a healthy eye, this lens is transparent, allowing light to pass through easily. A cataract occurs when this normally clear lens becomes cloudy, making vision blurry, dim, or distorted over time. To explain this more clearly, consider the experience of an older American man named Robert Miller. Robert was in his early 60s when he first noticed that reading street signs while driving at night was becoming difficult. At first, he assumed his eyeglasses needed an update. However, even after changing his prescription, his vision still felt hazy, as though he were looking through a fogged window. Colors appeared duller than before, bright lights caused glare, and night driving became uncomfortable. What Robert did not realize was that the proteins in his eye lens were gradually breaking down and clumping together, creating cloudy areas that interfered with light passing through the lens. This process is what forms a cataract. Cataracts usually develop due to aging, which is why they are most commonly seen in older adults. Over the years, the lens undergoes natural wear and tear, and its structure changes. However, age is not the only cause. Cataracts can also develop as a result of diabetes, prolonged exposure to ultraviolet sunlight, smoking, excessive alcohol use, eye injuries, certain medications like long-term steroid use, or previous eye surgeries. Some people are even born with cataracts, which are known as congenital cataracts, though this is less common. In Robert's case, age and years of working outdoors without protective eyewear likely contributed to the condition. Another American character, Emily Johnson, a schoolteacher in her mid-40s, developed cataracts due to uncontrolled diabetes. Emily noticed that her vision fluctuated from day to day and that bright classroom lights caused discomfort. Her condition demonstrated that cataracts are not limited to elderly individuals and can affect people at different stages of life depending on underlying health factors. The symptoms of cataracts often appear gradually, which is why many people ignore them in the early stages. Vision may become blurry or cloudy, sensitivity to light may increase, glare from headlights may become bothersome, and double vision may occur in one eye. Colors may appear faded or yellowed, and frequent changes in eyeglass prescriptions may become necessary. Because these symptoms develop slowly, many individuals adapt to them without realizing how much their vision has declined. This is why routine eye examinations are important for early detection. When cataracts are mild, vision changes can sometimes be managed temporarily with non-surgical approaches. These approaches do not remove the cataract but may help a person cope with symptoms. Updated eyeglasses or contact lenses can improve clarity in the early stages. Brighter lighting at home or work can make reading easier. Anti-glare sunglasses can reduce discomfort in bright sunlight or while driving at night. However, it is important to understand that cataracts do not reverse on their own, and no medication or eye drops have been scientifically proven to eliminate cataracts. Over time, the cloudiness usually progresses. As Robert's cataracts worsened, even daily tasks like reading, watching television, and recognizing faces became difficult. His independence started to feel threatened. At this point, his eye care professional explained that when cataracts begin to interfere significantly with daily activities and quality of life, surgery becomes the most effective and commonly recommended treatment. Cataract surgery is one of the most frequently performed and safest surgical procedures in modern medicine, with a high success rate. Before undergoing cataract surgery, a comprehensive eye examination is performed. This includes measuring the shape and size of the eye, checking overall eye health, and determining the appropriate type of artificial lens to be implanted. During this stage, patients like Robert and Emily are informed about what to expect, potential benefits, and possible risks, ensuring they can make an informed decision. This educational approach aligns with responsible medical communication guidelines, emphasizing that treatment decisions should always be made in consultation with qualified healthcare professionals. The cataract surgery procedure itself is typically performed on an outpatient basis, meaning the patient goes home the same day. The surgery is usually done under local anesthesia, where the eye is numbed but the patient remains awake. This helps minimize discomfort and reduces recovery time. Robert was understandably nervous on the day of his surgery, but the procedure turned out to be quicker and more comfortable than he had imagined. During surgery, the surgeon makes a very small incision in the eye. Using advanced technology, the cloudy natural lens is carefully broken into tiny pieces and removed. One common technique uses ultrasound waves, a method known as phacoemulsification. After the cloudy lens is removed, an artificial intraocular lens is inserted in its place. This artificial lens is clear and designed to restore vision. It remains in the eye permanently and does not require special care once implanted. There are different types of artificial lenses available, and the choice depends on the patient's lifestyle, visual needs, and eye health. Some lenses focus on distance vision, while others can correct both near and distance vision. Some lenses also reduce the need for glasses after surgery. Emily chose a lens that helped improve her ability to read without glasses, which was particularly helpful for her teaching career. The entire procedure usually takes less than 30 minutes, and most patients experience minimal discomfort. After surgery, the eye is protected with a shield, and patients are given specific aftercare instructions. These typically include using prescribed eye drops to prevent infection and reduce inflammation, avoiding strenuous activities for a short period, and attending follow-up appointments to monitor healing. Recovery from cataract surgery is generally quick. Many patients notice improved vision within a few days, although complete healing may take several weeks. Robert was amazed at how bright and clear the world looked just days after his surgery. Colors seemed more vivid, and night driving became easier again. Emily also reported significant improvement in her classroom experience, as she could read student work and presentation slides without strain. As with any medical procedure, cataract surgery carries some risks, although serious complications are rare. Possible risks include infection, inflammation, swelling, or retinal issues. However, advancements in surgical techniques and technology have made cataract surgery safer than ever before. Patients are carefully screened beforehand to reduce risks, and postoperative care plays a crucial role in successful outcomes. It is important to emphasize, especially when sharing medical information on platforms like YouTube, that cataract treatment should always be individualized. What works for one person may not be appropriate for another. This type of information is meant for educational purposes only and should not replace professional medical advice. Anyone experiencing vision problems should seek evaluation from a qualified eye care professional. Preventing cataracts entirely may not always be possible, especially those related to aging, but certain lifestyle choices can help reduce risk or slow progression. Wearing sunglasses that block ultraviolet rays, maintaining a healthy diet rich in antioxidants, managing conditions like diabetes, avoiding smoking, and protecting the eyes from injury can all contribute to better eye health. Regular eye exams are also essential for early detection and management. In the end, cataracts are a manageable condition, and modern medicine offers effective solutions that can restore vision and improve quality of life. Robert regained his confidence and independence, returning to activities he once feared losing. Emily continued her teaching career with renewed clarity and comfort. Their stories reflect the experience of millions of Americans who face cataracts but find hope through proper education, timely treatment, and professional care.